2-minute question starting with Matthew. Please explain your view of the state's role in healthcare.
So, as I said, you come to the legislature with your own expertise, and mine is not healthcare. I'll tell you that. But you also learn, who in your caucus and who you caucus with is very important, and who in the chamber, and really who in the legislature has expertise. And we have a couple people in the House who are excellent on healthcare. Debbie Armstrong being perhaps the leader on that. The state's role. A lot of that money comes through as federal. I've heard a proposal to enact a sort of single-payer system at the state level. There was actually a presentation done in this room. That's intriguing to me. We got to make sure we can afford it, and we can afford it going forward. So, we're coming into the session with this surplus of sorts, and it's one-time money. So anything we start, we need to make sure we use recurring money. In healthcare, we absolutely have to rebuild our behavioral healthcare system, which this governor destroyed. I mean, literally destroyed. She shut down all the providers and outsourced it to Arizona based on a fraud allegation, which eventually was proven to be false. So we're still recovering from that. And one last thing I want to mention on healthcare, it's largely federal, Obamacare and all that. Healthcare is an incredibly important industry in New Mexico. So not just the healthcare providers, the care that people receive, but healthcare creates a lot of jobs, and good jobs. And if we want to develop New Mexico as a retirement destination, well, we need healthcare. No one's going to retire here. We have beautiful places you can buy a house and retire. No one's going to retire if we don't have good healthcare. So healthcare is absolutely important.
I agree with everything Matthew just said. I think our healthcare system is shameful. I think that I want to be a voice for making it rational. Most of the allocation decisions and the delivery systems are decided at the federal level. So as a state legislator, you manage the funds that are allocated. But I'd like to, I'm so tired of the context in which healthcare is discussed. What we can say with certainty is that our GDP is consumed by a larger segment of our GDP is consumed by healthcare than most developed nations. Our outcomes are distinctly mediocre, and there are too many special interests at all layers. There are too many profit centers, and we all pay for each other's care. When people show up at the ER, they get treated and taxpayers pay for them. So it's really a fallacy to say, well, is healthcare a right? You're darn right. Our tax dollars pay for healthcare for people who are uninsured, for people who aren't citizens, and what we need to do is have a better system. It's crazy. Just to take drugs for one example, we pay so much more for American drugs than Canadians pay for American drugs. Medicare doesn't even bid that out. There's a whole industry in that chain called the prescription benefit managers. They don't do anything except insert money. And the reason it's so shamefully expensive is because the special interests in all branches of that have their checks into the pockets of politicians.